When you come in here and see the children, you understand why you're actually running the programme.
It's about people coming around the table and saying what don't they do, what's not happening, and how do we fill those gaps.
I think it's the most effective way of really getting to all the families that need help and making a difference.
Nearly £11 billion has been spent over the last 10 years on a range of initiatives designed to improve the health of young people, but what we found is that the outcomes have been disappointing.
What we've seen at a local level is local bodies targeting children, but the 0 to 19 age group, and as a result the under 5s perhaps in some areas haven't had the targeted provision that we might be expecting to see.
So what we're calling for is for local authorities with their partners to have a single set of priorities which reflects the different makeup of different localities and which will be operating within a clear policy framework set by government.
We've got a lot of good evidence, particularly in the report, to show where local bodies are making an impact and actually having a tangible improvement on the health of under 5s. For instance, in Blackpool, the Springboard Initiative has a multi-agency approach which is focused on targeting a select number of families, and drawing on partnership working, they've actually developed some serious improvements in the health of their under 5s.
The specific aim of the project was to pilot work with 60 chaotic families. It was a key worker assessing the whole family, not just one person, but looking at the family as a whole, looking at the needs of that family as a whole, and looking at what services could provide, and also looking at what wasn't being provided and filling those gaps. They were living in crowded accommodation, they were living in poor accommodation, parents weren't claiming all the benefits sometimes that they should have been getting them into childcare. So some of the children, especially the younger ones, the preschool children, were living in these houses during the day. So by getting them into childcare, we were getting them good food, they were well looked after in warm accommodation. We've brought together housing, we've brought together adult services, adult mental health services are heavily involved with us, children and adolescent mental health services, the police, housing officers, children's services officers, social services. Everybody's working together to the good of the family, and rather than working with individuals, they're now looking at the family as a whole. They really are thinking family.
The Chai Centre in Burnley is a really good example of where we've seen joined up, sustained delivery for children under 5.
Poverty affects nutrition, it affects the housing that people live in, which has a bad effect on health. It has a huge impact on mental health and emotional well-being. We run a gym. We've got a big healthy eating project, which is about working with all sorts of different groups of people. So it may be people who can't cook at all, and we're teaching them to cook. We've got daycare on site. We also have a women's health clinic, a stop smoking clinic, midwives and health visitors on the premises doing antenatal clinics and child health. In between the visits that the health visiting team make to families, the Children's Centre team go out, and they're going out with specific health messages and also messages around speech and language, early learning, parenting. So in effect, every family is going to get twice as many home visits. The other thing we've done is to share health records, which makes families safer. If there's actually a child protection issue, we're a lot less likely to miss it. Working together, it's absolutely vital. It's the only way we can be sure that we're working as efficiently as we can, as effectively as we can, and making as big a difference as we can.
Redbridge also demonstrates an interesting case study for us.
The Roma Gypsy community is a unique community right now to Redbridge. One of the first things we picked up was that many of the children weren't accessing health services. None of the children up until that point had had immunisation, seen a dentist, had access to a GP.
We have in some cases 40 people living in one household. A newborn comes into the world in the Roma Gypsy culture, and yet the authorities have no recognition that a newborn baby has actually been born altogether. We on a Monday run a mothers group here where we have a health visitor who comes in and visits the group. It allows that health visitor to actually start to see, first and foremost, the mother with the newborn. We work very closely with the child protection team of the borough. We're able to refer to them any issues we have. Other agencies of the borough are really recognising this group as being a nerve centre for the Roma community.
We want them to gain in confidence, we want them to be part of Redbridge, and also really ensuring that these kids access education, get into schools, access their health visitors, their GPs, their dentists, and basically become part of our wider community.
What we have in the report is a number of case studies that show what a difference can be made when action is targeted, where it can most have an impact.
We recognise that there are limited resources to go around, but we also recognise that localities, as shown in the report, have the opportunities and through innovation can make a difference to the lives of children.